Welcome to the Antelope Valley for those of you who traveled here. We're so glad you made it safely. And for those of you who call this community home, thank you. Thank you so much for your openness. And thank you to being open to having so many guests today. We're really grateful for this community and for the opportunity to be here today. My name is Taylor Dudley, and I'm the Executive Director with the UCLA Pritzker Center. And alongside our faculty directors, Dr. Tyrone Howard and Dr. Audra Langley, with our passionate and dedicated staff and students, we are here today to share our work and build relationships in furtherance of finding safe solutions to the ongoing problems facing domestic violence survivors and their children. So for those of you new to our work, the UCLA Pritzker Center, established in 2018 with a generous gift from the Anthony and Jeannie Pritzker Family Foundation, has a twin mission: to prevent the need for foster care and to support system change. We do this work through three primary strategies: research, education, and partnership. We bring this strategy to life with activities like this one, thinking about how to safely keep children out of foster care, how to support the social workers and individuals working within our system on domestic violence. And we do it through research and then share our findings at educational events like this with so many of our partners and friends working together, some of whom I'd like to recognize now. I'd like to recognize Supervisor Barger for joining us today. Thank you so much. And many thanks to your amazing staff for supporting us with this event. Brenda Nichols, the LA County Director for the Department of Children and Family Services. Sarah Perry, Lisa Dawson, and Shanice Brown with Valley Oasis. A special thanks to Valley Oasis for jumping at this opportunity to work together and bringing our work to life with unmatched care and enthusiasm toward making a difference in the lives of domestic violence survivors and their families. We'd also like to recognize and thank Children's Law Center for their support toward training and partnership in this effort, and especially recognize our funders. The Blue Shield Foundation of California, represented today by Carolina Morales. Thank you so much. The Van Nuys Charities, represented by Audrey Salzberg. And the Pritzker Foster Care Initiative, represented by Lauren Nichols. There is none of this work without all of you, our funders. Thank you so much. We also want to recognize additional special guests joining us, including Dr. Christina Galley with the LA County Department of Health Services. Christina. There she is. Thank you, Christina. Dr. Shannon Tyne, our LA County Chief of Pediatrics, who really helped us grow this work in the Antelope Valley with her vision and her support. We thank her so much. Representatives from the offices of Congressman Mike Garcia and California State Senator Scott Wilk, thank you for being here. And of course, I really want to honor and thank our team, our faculty, staff, UCLA colleagues, and students, some of whom you'll meet today. They are the best. And this is a gratitude shout out to each and every one of you who worked on this project. We'd also, again, like to thank our community partners, faith-based friends, and the schools here in the Antelope Valley who welcomed us here from day one. We appreciate your embrace. The LA County Library, shout out to John. They opened this space just for us today. We would not be here without the LA County Library opening for us today. Generations Coffee, where's Nicole? Thank you so much. Thank you, Nicole. So Generations Coffee not only provided our food and beverage, but they also provide job training to youth here in the Antelope Valley. So let's all thank Nicole and the Generations Coffee. And finally, with this being Domestic Violence Awareness Month and all year long, the utmost thanks to the survivors. We see your strength, your courage, and your bravery. We thank you for the countless contributions you have made to this work. This work that we have done has been informed by survivors from day one. We've met with them, we talk with them, they share their feedback, their ideas. They're represented in all of the research that you'll hear about today, as well as the video that we'll show you shortly. We cannot thank the survivors who bravely stepped forward enough, and let's give them a round of applause. I I am now pleased to introduce my co-host, Isabella Reyna. She will provide our land acknowledgement and, like I said, serve as my co-host today.
Hi everyone, my name is Isabella Reyna. I'm a third-year Public Affairs and Communications double major at UCLA. I'm also a research assistant at the UCLA Pritzker Center. UCLA is located on the traditional, ancestral, and unceded territory of the Gabrielino Tongva peoples. We recognize the Gabrielino Tongva peoples as the original stewards of the land and honor their enduring relationship to it. Today, we also acknowledge the original inhabitants of the Antelope Valley, including the Tataviam, Vanayume, Nuwuva, Serrano, Kawaii-Sioux, and Kitani-Mook peoples, who call this region home. We are so grateful to be here. I'm now pleased to introduce Dr. Lisa Gantz and our Avenue team. Dr. Gantz is a physician with the LA County Department of Health Services based at High Desert Regional Medical Center. Dr. Gantz also serves as the UCLA Pritzker Center's Antelope Valley Child Health and Wellbeing Fellow. Our students will be introducing themselves.
Thank you so much, Isabella, and thank you, Taylor, and thank you all so much for being here today. Before you hear all about this incredible research study, I'm excited to give you a sense of how the UCLA Pritzker Center work in the Antelope Valley has grown over the past 4 years. I was born and raised in Canyon Country, not far from here, and was thrilled to move back to northern LA County, less than a mile away from where I grew up, after finishing my medical residency at UCLA. I had long dreamed of working for the LA County Department of Health Services, or DHS, to serve my community. I work as a primary care doctor at the DHS High Desert Regional Health Center. With the support of Dr. Shannon Tyne and Taylor Dudley and the UCLA Pritzker Center, I also serve as the Antelope Valley Child Health and Wellbeing Fellow from 2020 to current. DHS is the single largest pediatric healthcare provider in the Antelope Valley, serving over 12,000 families. We also provide medical services at one of the busiest hubs, serving children who are DCFS involved. As everyone here probably knows, and I see in my daily clinical practice, this community faces some unique challenges. Our geography places us over the hill from so many of the resources and programs that serve LA County. Although there have been significant population growth here over the past 15 years and many efforts from committed community leaders, some of the needed infrastructure, funding, and crucial family-facing supports still do not meet our community's growing needs. But as everyone here also probably knows, this community is incredibly tight-knit, resilient, and creative. Recognizing these two realities, we began our work in the Antelope Valley by seeking to better understand community needs and to understand existing community collaborations and efforts. The UCLA Pritzker Center has been central to catalyzing efforts to help our team at DHS to develop stronger and more effective partnerships with our incredible community partners and sister agencies. In 2020, this resulted in us launching a project called Avenue, the Antelope Valley Engagement Network United for Equity, with the goal to expand access to trauma-informed care and resources within the Antelope Valley through education, integration, and partnership with and for our community. This work has taken on many forms. We provide resources and technical support to existing community collaboratives, such as the monthly Antelope Valley Health Neighborhood Meetings run by our partners at DMH. Our Avenue team helps raise community awareness of local resources, programs, and events in the AV by compiling AVHN's weekly newsletter and sharing on social media channels. If you aren't already following us, check out the QR codes. We have our link tree, and we hope you join our weekly newsletter to hear about all the incredible things going on locally. Our work with Avenue has also fostered partnerships with UCLA to meet community needs in creative ways. In partnership with DMH, DHS, and UCLA, in 2022, we launched the Antelope Valley UCLA Public Partnership, also known as AV UP, which utilizes an integrated behavioral health model to provide mental health services to children at DHS who otherwise were not having access to services. This has helped us meet the overwhelming demand for services in the wake of the COVID pandemic. Avenue has also sponsored continuing education, including a community spotlight series to raise awareness among our DHS staff about the incredible community partners we have nearby. And we have compiled a community asset map on a platform called 1 Degree, a free online platform that allows our clinic to share resources with children and families and refer our patients to social services directly in their community. Our Avenue student leaders from UCLA, some of whom grew up here in the AV, helped propel all of these efforts forward. I am so honored to work with them and so thrilled to introduce them who will share more about our work.
Hello everyone, my name is Brittany Hun and I graduated from UCLA in 2023 with a degree in human biology and society, and I plan on attending medical school next fall. As an early example of our efforts in the Antelope Valley, we partnered with LA County Departments of Health Services and Public Health to increase access to healthy foods. With these partnerships, we hosted once monthly no-cost fresh food distributions serving hundreds of families each month. And during these events, we also have unpacked and given out tens of thousands of diapers from Baby2Baby.
Hi again. Our Avenue team also supports the Day of Giving and community-based events hosted by partners such as the Antelope Valley Community College. These events really allow us to share our work, share resources with the community, and most importantly, listen to the needs and advice of the community.
Thank you, Isabella. Hello, everyone. My name is Meza, and I graduated from UCLA this year and am now a registered nurse at the emergency department at the Antelope Valley Medical Center. Thank you.
Where are you from?
I'm from the Antelope Valley. So I joined the Avenue team through the UCLA Pritzker Center to advocate for my beautiful community, the Antelope Valley. Our team has heard directly from the community about the challenges they face on a daily basis, which led to the formation of our research efforts. The Antelope Valley Needs Assessment came from our team's desire to find peer-reviewed research that described the challenges we were seeing in our community. While these findings are sometimes disheartening, we are glad that the lived experiences of this group and the community can be affirmed by our work, and hope that this needs assessment can inform future research and policy efforts to address these challenges. We will review a small portion of our landscape analysis, focusing on findings that are particularly relevant to some of the challenges facing survivors of domestic violence, which we will turn to shortly. Before we begin, it's important when talking about SPA 1 that we understand the difference between urban and rural communities. Antelope Valley is classified as a semi-rural, which is sometimes used interchangeably with suburban communities, which are areas that are neither urban or rural. The in-between classification of the Antelope Valley is a big determinant in the outcomes and situations that surround our community. Due to the urban classification of semi-rural communities, these regions are not eligible for many rural developmental programs, such as the Federal Office of Rural Health Policy Grant Programs, despite us facing many of the same challenges that traditional rural communities face.
Given the AV semi-rural classification and ineligibility for certain grants, the overall health and well-being of this community is often overlooked. The Kaiser Permanente Community Health Needs Assessment depicted the AV's Neighborhood Deprivation Index in these graphics. The NDI is a validated scale of various social factors associated with lack of opportunity to be as healthy as possible. These measures are proxies for underlying determinants that disproportionately affect communities of color, including lack of employment opportunities, racist policies and practices, and unequal treatment by education and criminal justice systems. The map on the left shows the NDI for zip codes in the Panama City, Antelope Valley service area, and areas with the highest NDI often are those with the highest proportion of people of color, shown in the map on the right. As employment and poverty are just two of the social factors affecting the NDI, the Kaiser report also broke it down for us. Antelope Valley-wide, 23.8% of families and individuals live below the poverty threshold. And this is also a direct reflection of the high nominal unemployment rate, which is about 17%. If you take a look on the map on the left, it compares the NDI relative to the portion of people of color living in the area. And so looking at that red area, which would be our SPA 1, this indicates a relatively higher proportion of people of color and higher rates of poverty again.
As mentioned by Mia earlier, the Antelope Valley's semi-rural classification plays a role in housing prices, which compounds the poverty rate in the AV as well. Affordable housing costs drew families to the Antelope Valley during the recession, and between 2000 and 2010, there was a 23.6% population increase in Palmdale. The once desirable housing costs in the AV are no longer exist in a post-COVID world, leading to increased homelessness in the area. A study conducted in 2021 analyzed the ratio of cost of living and income of families in the Antelope Valley in comparison to the rest of LA County. Black families have the most polarized ratio compared to the rest of LA County, as you can see on this graph. While Black families are the most impacted, families in general are also being impacted by the cost of living. Families with children under 6 are also experiencing a higher gap compared to general LA County. As housing is the forefront of the cost of living, we can conclude that housing costs have disproportionately affected families with young children and Black families. Aside from these two subgroups having significantly higher ratios in the AV, overall renter households are being impacted. In the Antelope Valley, 3 in 5 renter households are paying housing costs that are over 30% of their income. In other words, 60% of renter households are rent burdened.
As mentioned earlier, our team has witnessed firsthand the strong need for food here in the Antelope Valley. And looking at the data from the LA County Department of Public Health assessment back in 2017, we can confirm that food insecurity has been an issue long before the pandemic. At the time, the highest prevalence of food insecurity in LA County was found to be in the Antelope Valley.
Limited childcare presents another unmet need. In the AV, a survey suggests that no AV zip code has sufficient access to childcare. The results conclude that 40.9% of the Antelope Valley's parents or caregivers report difficulty finding childcare, which is the highest among all LA County SPAs. This leaves caregivers with the difficult decision of working less or leaving the workforce completely. This finding is especially relevant to the survivors in our domestic violence study.
Hello everyone, my name is Olivia Gilchrist and I'm a third-year undergraduate student double majoring in psychology and public affairs. In our research, we found that most available data talked about SPA 1 as a whole, not about the Antelope Valley specifically. This makes data-informed policy changes challenging, as the AV covers a large geographic area that spans many smaller communities with unique needs, ranging from small rural areas to densely populated suburban neighborhoods. With this in mind, Avenue has begun a new research project in collaboration with DHS and the UCLA UCSF ACEs Aware Family Resilience Network, UCAN, to provide community-level data on adverse childhood experiences, also known as ACEs, experienced by children in the Antelope Valley. Some of these issues are mentioned on the handout on your chair. ACEs include experiences like abuse, neglect, or other household challenges, such as separation or divorce of parents or witnessing domestic violence. Experiencing ACEs can have profound and lasting impacts on a child's developing brain and impact their health and well-being for years to come, especially if children do not have supportive buffers in place. ACEs screening is a statewide priority, and screening can create critical opportunities for prevention, early detection, and intervention on an individual level. Since 2020, DHS has conducted over 40,000 ACE screens, including over 3,000 families in the AV. Our work will focus on mapping the prevalence of ACEs in the AV to inform and guide policymakers and community agencies on areas of greatest need.
In my work as a pediatrician in the Antelope Valley, I have worked with many families who have experienced ACEs, including many who are survivors of domestic violence. ACEs have been linked to an increased risk to a number of medical and mental health conditions, ranging from cancer, substance abuse, depression, and cardiovascular disease. But importantly, ACEs are also associated with an increased risk of experiencing domestic violence in adulthood. Our hope is that through this work and our continued partnerships, our team at the UCLA Pritzker Center can continue to identify prevention strategies and policy recommendations to better support children and families in their journey to healing. Thank you so much.
got into altercation with my baby daddy, and I was referred to Valley Oasis parenting classes and domestic violence classes from my DCFS worker. It was mandated through the court that I had to take parenting and domestic violence. And so I signed up to Valley Oasis, started there, but DCFS did push me a little bit harder because I had a kid previously in an abusive relationship, and they took my kids and adopted them out. I just promised myself I would never make a mistake again. I would do anything and everything I had to do for my kids. Honestly, I want to do better for her, I guess. So to keep me going, I just think of her. I want to do better for her. I want to give her better. I want to show her better. I want to break generation curses and treat her better and learn how to parent better. Things my parents have shown me. She is my inspiration to be better as a parent. One thing I understand now, the yelling and the screaming and arguing around them, I get it. They don't need to see it. It does have an effect on them. I understand that, but also I do feel like I'm the victim in that. I was getting yelled at. I was getting attacked. I was getting beat on. I don't yell at them when the dad's not around. They were okay, but being yelled at or being beat on wasn't my fault. But I do understand that that had an effect on me.
Yeah, I was about 8. I went to a grocery store that was nearby. I stayed there for, I don't even know how many hours. I just sat on the ground, just stayed there until somebody called. They gave me food and stuff, and then they called DCFS. DCFS came.
That one was very physical. I got beat, stabbed. I had to go to the hospital a lot. 5 years I was in an abusive relationship, and they're like, why don't you just leave? You're getting beat every day. Why don't you just leave? And then I wanted to leave, and it's hard to pack up your kids and all your stuff and leave. I don't know how to do that. I had 3 kids, all this stuff. Even if I just take my 3 kids and leave, where am I gonna go? He secluded me from everybody. I had no friends, no family. I didn't know where I was gonna go. I didn't have a phone. I was so secluded. Every time I tried to get away, I got beat worse when I came back or when he found me.
I think DCFS should know when they go into homes to be mindful of the person you're working with.
Yeah.
Don't judge off what a house may look like, or how the kids may be dressed, or how mom may be dressed.
My second experience, I had a great social worker. She was actually on my side. I was very happy about that. She was very much on my side. I talked to her kind of like a friend. I was scared that was gonna backfire on me, but it never did. I was very open with her, and she was very helpful. And she never went and told him anything I said, which I respected, because she was also in contact with him. She gave me a whole bunch of resources.
When I went to pick you up and saw you, it was like something like in my heart that, I was glad I was there to help you bring through your daughter there. I know the day we talked in the office and you told me your story, I just was like, gosh, she's so strong, and I wanted you to know that. Just be proud of yourself.
Okay.
Be proud of yourself. It's okay to question yourself, but be proud of yourself, though. It's okay sometimes to even go back and feeling sad. It's okay to have those emotions. But just keep pushing forward, because you've come so far now.
Should we all take a collective breath? I know that was a heavy one. Okay. We will now begin a conversation about our report with Dr. Tyrone Howard and Dr. Brenda Tully. Dr. Howard holds the Pritzker Family Endowed Chair and is a professor in the School of Education and Information Studies at UCLA. Dr. Howard is considered one of the premier experts on race, culture, educational equity, and access in the country. Dr. Tully serves as a research director for the UCLA Pritzker Center. 20 years of social work practice with children, youth, and families informed Dr. Tully's work. Brenda led the research study we are discussing today.
Thank you, Sophia. Good morning, everyone. Good morning. We need to pass the tissue around after that last video. I want to say, I told Brandon earlier that it's time for us to have a dialogue about a topic that we have been far too silent about for far too long, and that is domestic violence. And it's time to unsilent the silent dialogue. And so that's why this is so important. And that's why your being here today means the world to so many individuals, survivors in particular, who have been bold enough and brave enough to share their stories. And so we want to thank them and find a way we create more humanistic and more loving systems that don't demonize them, but that lift them up and support them. So for survivors of domestic violence and advocates like Brittany, Monica, and Shanice in the video, obviously we have a lot to do to make this better. Yet many of us still have lots that we can learn. Listening to survivors and talking about domestic violence are key to our learning. So let's talk about what happened when a relatively novel collaboration was formed between domestic violence advocates and child welfare practitioners here in the Antelope Valley. We'll begin with a little bit of background. The Los Angeles County Department of Children and Family Services operates one of the largest child welfare systems in the United States, as you all know. Domestic violence, sadly and unfortunately, plays a prevalent role in the lives of system-involved families. Let me be clear, let us be clear. Race, poverty, and gender all play prominent roles in domestic violence coming to the attention of child abuse hotline and child welfare systems. How the child welfare system responds matters profoundly to survivors and their children. In 2020, a collaboration between the UCLA Pritzker Center and stakeholders across LA County and a subsequent report explored the role of domestic violence in the child welfare system. The study identified 3 primary issues and opportunities for change where these systems coincide. First, child welfare systems professionals lack in-depth knowledge about the complexity of domestic violence dynamics and resulting trauma. Moreover, we found that biases amplified the harms experienced in many Black survivors and others. Recommendations call for training in these areas. Second, we also found that child welfare teams often did not include domestic violence specialists. Recommendations called for the collaboration between child welfare and domestic violence service providers to address this issue. And finally, the need for legislative and policy reform were highlighted to increase opportunities to safely support parent survivors and their children in avoiding separation where possible and enhancing the likelihood and speed of safe reunification when a child welfare case is open. In response to these findings, in 2023, the UCLA Pritzker Center launched a pilot study in partnership with Valley Oasis, big shout out to Valley Oasis again, a domestic violence service agency, and the DCFS Lancaster Regional Office, shout out to Lancaster, DCFS Office Lancaster. The current research was situated in the Antelope Valley for the reasons outlined by our Avenue team earlier. The purpose of this research was threefold: to document the experiences of parent survivors of domestic violence service providers, and child welfare staff, to develop a collaborative response to these experiences, and finally to evaluate the interventions implemented. I will turn now to Dr. Tully, and she will tell us what we learned.
Thank you, Dr. Howard. All right, to orient everyone to the terms that we're using, when we use the term domestic violence, we are referring to a pattern of abusive behavior between intimate partners where one partner exerts power and control over the other. Domestic violence dynamics are different from high conflict relationships, where conflict may be mutual and may include verbal and physical aggression or violence. I'll talk more about how that came up in our study shortly. And then finally, I'll refer to survivors of domestic violence who participated in our study as parent survivors, because they are parents first and foremost. What did we learn? First and foremost, we learned that parent survivors struggle against numerous barriers while their child welfare cases are moving along. As Brittany and Monica shared earlier, parent survivors sometimes experience child welfare and exposure to domestic violence as children, and then domestic violence as adults. Cumulatively, these experiences can result in complex trauma for some survivors. In this state of mind, making plans to leave was often difficult for the parent survivors in our study. On top of that, economic considerations trapped parent survivors in violent relationships. When parent survivors attempted to leave, they often discovered limited emergency housing options at a time of heightened vulnerability. In short, like Brittany shared earlier in the video, leaving, while necessary, was not as easy as it sounded. When child welfare systems get involved, parent survivors were often expected to navigate their case plan and complex social service systems alone. Our findings document that such expectations are unrealistic, both because of complex trauma and also in our study because services in the Antelope Valley were stretched thin, with waitlists delaying access to essential services for families in crisis. When parent survivors did enroll in services, they discovered additional barriers. Limited childcare, as we discussed earlier, and infrequent bus service in the Antelope Valley made consistent participation in services difficult. Scheduling conflicts made locating domestic violence survivor classes and parenting classes difficult for working parents. And there was a need for a new array of mental health services for parent survivors and their children. Importantly, our analysis showed that racial bias against LGBTQ+ individuals, immigrants, and men survivors added complexity to service accessibility and participation. By law, as noted earlier, child welfare staff and service providers played critical roles. By law, child welfare staff are charged with authority. How they use this power in relationship to families was essential. Patterns of power and control could be replicated, leaving parent survivors feeling judged and blamed for circumstances beyond their control. This same authority, however, could empower a survivor, like we heard from Brittany with her second social worker. As a social worker myself, I can attest to the fact that this work is incredibly hard. Our analysis found evidence of potential secondary traumatic stress among child welfare staff and domestic violence service providers, which may have hindered their ability to fully engage with parent survivors. Another key learning was that child welfare staff must distinguish high conflict relationships from domestic violence. This was essential for determining the type of support that each family needed to keep them safe moving forward. So we presented an initial version of these findings to our partners at Valley Oasis and DCFS Lancaster, and they worked together to come up with 2 interventions that we then evaluated as well. So to address the need for greater depth of domestic violence knowledge among child welfare staff, the 2 interventions that Valley Oasis domestic violence consultants facilitated included an advanced training on domestic violence dynamics and also domestic violence consultations. So we found that the advanced domestic violence training resulted in significant knowledge gains about domestic violence among DCFS Lancaster staff. We also learned that the domestic violence consultations supported DCFS Lancaster staff in applying what they learned in their work with families who were referred due to allegations of domestic violence. So what do these recommendations, or what do the findings suggest in terms of what do we do moving forward? So broadly, we learned that additional and tailored reform across the social and economic infrastructure of LA County is necessary to support families experiencing domestic violence. So this is not just DCFS can fix this. This is all of us. This is all of us needing to come together. So the results called for action in a number of areas, which you can see here, but I'm going to highlight 3. And there are more on your one-page sheet on your chair. So first, within the DCFS space, enhancing and scaling collaboration between DCFS offices and domestic violence service agencies across LA County would further the work in this area and make a big difference to families. And then also accelerating efforts to transform DCFS organizational culture to continue to actively address and dismantle anti-Black racism in both policy and practice. And then finally, in the larger county ecosystem, addressing financial barriers to parent survivors leaving violent relationships and while working to establish separate households is essential. We can't have poverty keeping people in dangerous situations. So these recommendations obviously require collaboration across LA County departments, nonprofit service providers, and with domestic violence advocates and parent survivors.
Thank you, Dr. Tully. In summation, domestic violence and other contributing factors such as poverty and racism flood the child welfare system. The UCLA Pritzker Center research demonstrates that if we want to reduce the size of the system, this is a good place to start with some new strategies. The age-old idea of you should just leave does not work anymore. Let me say that again. The age-old idea of you should just leave does not work anymore. Survivors want the best for their children and are deeply committed to breaking cycles. They need personalized supports to overcome systemic barriers and safely care for themselves and their children. Additionally, tailored reform across the social and economic infrastructure of LA County is necessary to support families and children who are experiencing domestic violence. We'd like to thank our funders, the Blue Shield Foundation of California, Van Nuys Charities, and the Pritzker Foster Care Initiative for making this work possible. Thank you so much.
I am now pleased to introduce Supervisor Barger, dedicated to providing effective, responsive representation to the residents of Los Angeles County. Supervisor Barger began her career in public service as a college intern in the office of former Supervisor Antonovich. Supervisor Barger was elected to the board in 2016. She served as the chair of the board and was re-elected for her second term in 2020. Welcome, Supervisor.
Wow, I mean, I'm taking this all in, and I am so grateful to see you all up here. How many are from the Antelope Valley? Very good, very good. Welcome and good morning. Thank you for taking time out of your busy schedules to be at today's event. During our time together, we'll learn more about the new research being released by the UCLA Pritzker Center on the issue of domestic violence and its impact on our child welfare system in the Antelope Valley. But I will guarantee you what's happening up here in the Antelope Valley is happening countywide. There are so many people and organizations I'd like to thank for making today's event possible. Of course, the UCLA Pritzker Center for its insightful research and for organizing this conversation. Of course, DCFS Director Brandon Nichols and DHS Director Christina Galley and Dr. Shannon Tyne with DHS. and a Valley Oasis, who is an incredible partner for partnering with the UCLA Pritzker Center on a pilot study on the issue in 2023, along with our DCFS Lancaster office. I want to especially do a shout out to the DCFS Lancaster office, who we know has a caseload and complexity that does not mirror anything down below, as well as the Palmdale office. So I want to give our DCFS workers a round of applause. In addition, the Blue Shield Foundation of California, Van Nuys Charities, and the Pritzker Foster Care Initiative for investing in this work up here in the Antelope Valley. And most importantly, the survivors who participated in this study, whose bravery and courage sets a powerful example for us all, and whose stories allow us to make changes that are going to better our communities. The Antelope Valley is a community rich in history, vibrant in culture, and dynamic in growth. I'm always struck by the resilience and power of our Antelope Valley residents and the neighborhoods. Some of you will recall that in 1980, former 5th District Supervisor Antonovich created a task force to identify services for domestic violence victims. Shortly after, Valley Oasis was incorporated in 1981 as the Antelope Valley Domestic Violence Council. With this background in mind, I'm glad to see the work on domestic violence issues in the Antelope Valley continues, because it is still a very present concern. Recently, DCFS data showed that more than 50% of the cases involved an allegation of domestic violence. Survivors of domestic violence face complex trauma, often rooted in their own childhood experience with domestic violence and the foster care system. In my role as supervisor, I interact with children and families often, and I know firsthand that foster care can be necessary in some cases, but for some families, there may be safe alternatives for survivors of domestic violence and their children. Children in our foster care system are involved through no fault of their own, and it's important for the county to do all we can to reduce the trauma they have experienced and reunify families when it is safe to do so. I want to encourage my county colleagues here today to think critically about your resources, how we might better support domestic violence survivors and their children, and how we can partner with DCFS on this effort. I also want to recommend that we think how our county's poverty alleviation program could establish innovative programs for those in DV relationships with their children. The report authored by the UCLA Pritzker Center has several important findings and recommendations that will inform our path moving forward. I'm especially interested in better differentiating DV cases through the hotline, ensuring the safety of those placed in motels involved in our housing voucher programs, improving classes and other required programming for survivors, and paying for those and being able to reduce the barriers to completion, and expanding public transit in our North County, increasing child care access and affordability, something that is a Herculean effort, especially given the numbers, not only in the Antelope Valley, but in the county as a whole, and then the costs associated with it. The authors of this report gave us all a shared understanding and a great foundation to work from. It's evident that a lot of innovation has happened here, and good work is ahead. I'm encouraged by the work done by the UCLA Pritzker Center in partnership with DCFS across the high desert. When academic institutions, philanthropy, and the county all work together, true change can happen. Thank you all for your work on this critical issue, and I look forward to continuing to move forward to support survivors and protect families in the future. Again, thank you all for being here, and I look forward to my marching orders on what I need to do to make it happen. And given the people in this room, I know Dr. Galley's back there, Brandon, Nichols, we can and we will make it happen. Thank you.
Thank you for your remarks, Supervisor Barger. The Los Angeles County Board of Supervisors appointed Brenda T. Nichols, Director of the Los Angeles County Department of Children and Family Services, or DCFS, in April of 2022. Director Nichols is regarded throughout the nation as an accomplished professional with more than 20 years of expertise in child welfare, foster care, adoptions, mental health, and law. I'm welcome.
This is not for talking. I'm going to let you in on 2 secrets, none of which are going to surprise you. One, when you're the director of DCFS, you got a lot of stuff in your head. And sometimes you think even contradictory things at the same time. You feel contradictory ways at the same time. Probably more often than not. And, this was not on my notes. And I have to stand over here for the microphone anyway, so I'm not really going to look at my notes. But, when I came in this morning, I felt that wave of contradiction in my feelings. One, I am so happy that all of you are here and care enough about this issue to show up and fill the library. So happy that we have some wisdom, some data, some study from a bunch of different kinds of people and the stories of survivors to help us do better. I'm really happy. You probably can't tell, but I really am happy about this. But I'm also really sad, and that's the contradiction, right? I am really sad because this is such a big issue in our community. There's a library full of people here that want to hear about it. That we had to bring in experts in university and funders to dig deeper. That experts in this room, professionals that are working with domestic violence survivors today, need wisdom to know how to do that. They don't know. It's a prevalent problem in our community that we all have some level of ignorance about, and that makes me sad. So that's secret 1. Secret 2, I don't have all the answers. I know that you would like a director of DCFS or a leader of one of these agencies in a community responsible for the lives of kids and families to have all the answers, and I have to tell you, I don't have them all. And I am profoundly thankful for studies like this and experts like this and conversations like this to help give me some answers, to help shine some light on stuff that I don't know, to help give me a little bit of a map to move, at least in my role and my part, move our system forward to better serve families and keep kids safe. And I think we all the people who filled this room today want the same thing. We want families to be together and we want kids to be safe. Sometimes that's a really complex ask, and sometimes that puzzle's really hard to put together, and it can be particularly challenging when there is violence in the home. And we know from this study and others how impactful that violence can be. We know ACEs was referenced. I'm really thankful for the ACEs work that our county's doing. But the trauma that people involved in violent situations face as children echoes throughout their life. Their health scores are challenged, their life scores are challenged. We've seen some of the challenges that victims of domestic violence face, being lost, being afraid to ask for help. It's a system I help lead that makes them afraid of asking for help. I need to do better, we need to do better, and I think this is a step in that regard. I do want to thank all the folks involved. Genuinely, particularly I want to thank Valley Oasis, not just for their role in this study, but for the work they do here in the Antelope Valley all day, every day. They are like a point of relief, a point of security, a point of safety. You saw how they literally sit and cry with victims sometimes. Those are great people. Anybody doing that work, anybody up here holding their doors open for victims of domestic violence like that, day after day after day, they have my appreciation. They deserve all your appreciation, not just for the study, but for their work they have. So this is not the end of the conversation. This is not the end of the study. It's sort of a middle point. We have learned some things. We do have a little bit of a roadmap going forward. We have some ideas which we now have tested and will look like it'll make things better. And my commitment is we're going to try to do better. It's not just DCFS. I mean, not to minimize my responsibility or my obligation, but it is a community responsibility. And we've seen in the study how community can come together to do better. And I'm going to need probably everyone in this room, all the disciplines represented in this room, the political might of Supervisor Barger, who I do want to say is politically mighty and dedicated to making sure that families are doing better, to build up some of the things that we suspected but now know are needed: housing, trauma-informed care. You know, one thing that was interesting to me, bus access. You know, like I said, I don't have all the answers. I never thought about, like, oh, you need better transportation to help victims of domestic violence. Well, it turns out you do. It turns out it is complex, and you need those systems to work together. And I guess that is my commitment to everyone in this room. Twofold. One, I'm going to keep working on it. Two, I'm going to do what I can do to make sure that we're connected across government and government to community, to be there so that victims of domestic violence have a place to go, a place that's reliable, a place they don't have to be afraid of, and a place that can help lift them up out of those situations where they just feel sort of lost and hopeless. I want to thank the UCLA team for pointing something out. Again, it's something which, when I was thinking about domestic violence, wasn't at the top of my mind, but now I read it in the report, and of course it's true. The secondary trauma to all of the community members who come in contact with victims of domestic violence, they need you. You got to take care of yourself. This is not just a one and done. You need to be there for the long haul. You need to be there as a reliable resource for them in a month, in a year, in 5 years. And this can be tough on you. Particularly, I want to thank my DCFS social workers involved. This is challenging to them. It's challenging to be called on your assumptions, your biases, to be told you need to think in a different way. But I also want to recognize they undergo a lot of secondary trauma. They see a lot of hurt, a lot of ugliness. So they see kids get hurt. They see parents get hurt, and it's tough. And I want them to take care of themselves. And then I just want to ask that y'all take care of each other. You see my social workers, tell them they're doing a good job, pat them on the back, ask them if they need a bottle of water. They'll do the same to you. And I just want to close with thanking all of you for caring enough to show up in a library on a Tuesday morning. I am so glad all of you are here and that you care enough about this to sit and have this conversation. So thank you.
Thank you, Director Nichols. We will now move to our panel discussion. Our panelists include Lisa Whitecrow, Shanice Brown, Meza, and Brittany Callis, who unfortunately cannot join us today. Lisa is the Regional Administrator for the Lancaster DCFS office. She was a lead on the study from DCFS. Shanice is a Senior Case Manager at Valley Oasis. She also served as the consultant for DCFS on DV cases in this study. Mia is a recent UCLA graduate. She served as a research assistant on this study and as a nurse at the AV Medical Center in the emergency room. Brittany, who is a survivor voice, unfortunately cannot join us today because she is sick, but I'm pleased to welcome all of these people to the panel. If you would join us in the chairs. And Dr. Tully will be facilitating this discussion. Due to time constraints, we will not be able to take live questions. Can you hear me? You have to speak really close.
Thank you, Isabella, and thank you to my esteemed panel. I would like to just jump right in, if that's all right? Yeah? Okay, cool. So we want to start with the first question, which is, what is the most significant thing from the report to you, in your perspective, in your position? Who would like to start?
For me, the biggest thing was I didn't realize, can you hear me now? Better? For me, I didn't realize how much DV played a part in like the child welfare system. So during a lot of my consultations, I realized DV was a huge narrative. I didn't think I realized that until doing this.
Good morning, everyone. Can you hear back there? I know it's really hard to see. I think for me, what stood out the most was really having to read in print that impact and intent don't always match. And I think as you heard Brandon share and Supervisor Barger, that's a really hard reality for social workers. Our intent is to do right by families, to serve this community, to make good decisions, to make safe decisions. But for parents, survivors, and children, it does not always feel that way. And the outcomes don't always match what they hope for. And that was very painful to read, and we gave feedback about that because it was so difficult. And Brandon was there to remind us that we have to keep the charge moving forward, while sometimes knowing that we might err. Respect, compassion, education will help lead our way as we make the decisions that we need to sometimes make.
Can you guys hear me? Okay. I think for me, something that was shocking but yet not shocking was the pullback, the drawback from not only the survivors, but the community as a whole when the word mandated reporting or mandated reporter comes. And it's weird, as a community member, it scares me, but as a mandated reporter myself, I know my job. So it's kind of this between the worlds, trying to find, being scared, having that community trauma from the domestic violence in our community, but also knowing the due diligence we hold as mandated reporters. So I think that was really interesting.
Thank you, thank you. So let's shift gears and talk about how the report does center on the Antelope Valley. We've made that clear, and as a couple of people have mentioned, they feel, and we agree, that the experiences probably extend beyond the Antelope Valley. So let's first talk about, in your view, what makes the Antelope Valley a unique and informative place to have done this particular study.
As many of you may know or may not know, our emergency department is taters from going from number 1 through number 5. We're in a fight with USC, and receiving the most cases, either from patients, but also the highest cases of child abuse and domestic violence. We are one of the only hospitals to have a direct forensics unit in our hospital, which is kind of unique, and I think that also shows how the work here, specifically with domestic violence and the child welfare system, is really important because we're seeing it firsthand. Our nurses, our domestic violence workers, our DCFS office is seeing it at alarming rates, and of course that's across Los Angeles County, but our community is so unique because it is so small. It is rural, but it's urban. So I think we need solutions now in our community, and I think it being here in a place that needs it now. It needed it yesterday, it needed 2 weeks ago, but seeing it now, I think that's what helps, because then we know how to apply it to larger communities, ones that maybe have more resources, a bit more access, don't have to wait 2 hours for one bus. Yeah.
I think also for me, since I do get the hotline calls, there's an alarming amount of domestic violence in this area. And a lot of the problems is sometimes victims can't even get to safe locations because they don't have rides, and they end up staying in the situation.
What I would also add is that many people end up here in the Antelope Valley, but they're not from the Antelope Valley. And so the services, the community, the resources, the partnerships, they're unfamiliar, and even to service providers. So DCFS staff, for example, often have families that end up in this area, but the workers themselves are unfamiliar with the various opportunities and resources, et cetera. So families that might end up, for example, at Valley Oasis are not from this area. They are safely brought here to be able to benefit from the services that Valley Oasis offers, but they're totally unfamiliar with the neighborhood. They don't know even where to go to a local grocery store, and yet this is where they're now expected to survive and thrive.
Yes, thank you for your comments on that. I think for me, just to add a little bit, one of the things that stood out to me in our conversations with the parent survivors was just that a lot of them are not from Lancaster, they're not from Palmdale, they're not from the Antelope Valley. And so when they got relocated here, they were triply lost. They didn't know where to go, as Lisa said. They had no idea. And they also didn't have support systems that they would have had in their previous community, but they weren't safe there. And so that ask of survivors in what they shared with us was life-saving on one hand, and on the other hand, quite devastating. And particularly when it came to their children and trying to figure out schools, daycare, which we have heard several times is in extremely short supply. And then if they don't have a car themselves, then we have the transportation issue that Shanice also mentioned. So I think that when you put all the pieces together, it's the puzzle starts to look extremely complicated, more so than when it was just one piece here and another piece there. Okay, so let's talk about how these lessons from the Antelope Valley may apply across LA County, California, and perhaps in other areas of the country.
I certainly think that as a study, this is a microcosm of a larger situation and a larger system. I think that one of the things that I've heard from the minute I started serving this area, in particular 9 years ago, was about resource deprivation and all of what was lacking, and yet a shout out to all of the community partners that are here today. I've seen many. And this is an area that is robust in commitment to serving the children and families of this area. And I think that I hear many conversations that lead with all that we do not have here. And I want to make sure to highlight all that we do and the absolute commitment of this community. And so when we saw the first few slides that were shown about avenues, I even noticed things that I'm unaware of, despite the fact that I run an office that serves this whole area. So I think making sure that we continue to collaborate and team so that we don't have to operate in silos, that we can continue the partnership and the work, makes this a perfect example of how the best teaming, collaboration, education, information sharing can really lead to great outcomes for communities.
I so appreciate that. And I think one of the things that we've seen kind of across our work at the Pritzker Center, and I'm sure all of you have seen it too, is that when we get the word out about resources, there's always people who are like, I had no idea that existed. And it's just, I don't know, it's just the way the systems work, I guess. And so one of the key pieces that our Avenue team is doing is the weekly newsletter, which is a compilation of activities happening, but also resources in the Antelope Valley that are available. And oftentimes they're introducing new resources. One of the things I've noticed in that process is that there are so many small and mighty organizations serving the community here. And I think that's true in a lot of places, but I think especially here. And I'm wondering, Mia, if you want to talk a little bit about that?
Yeah, so I actually send out the newsletters. I didn't send it out today because I'm here, my bad. I'm so sorry, I'll send it out tomorrow. But yeah, so there's a lot, I think that's like something you touched on it very, like, I think we're partners. I think that's the mindset we all in this room need to have, is we are all partners. There is no hierarchy in our organizations. We all need each other. I'm telling you, the newsletters, Penny Lane, from Generations Coffee too, like they have events for the community that are much needed. Like I lost my neighbor during this study to domestic violence, and I didn't know it was right next door, and I felt responsible, even though I know it's not. I couldn't be home doing this study, analyzing what could be done when it was right next door to me. So I left Generations Coffee, and that helped me, because I was like, you know what, I need to separate myself. But I think it's just knowing what we have and expanding on that and relying on each other. And again, knowing that we can help each other, not. So I just want everyone to take away that we are all partners. We all can help each other. There is no hierarchy in what domestic violence victims need. They need us, and they need us to work together.
Thank you, Mia. You know, it's those moments where, you know, I think Brandon Nichols mentioned this, which is like, we're touched by this. Like, we can't pretend that, I can't pretend that I walk in a world that is free of domestic violence, because it's not. And I think, you know, listening to people's stories and then figuring out ways you can take action is super important, and we'll have some specific things that we'll share later. But I think when Mia shared her experience with her neighbor while we were finishing up the report, you know, it drove the point home that this is here and it's now. It's right now. And so our work together is essential. And I want to also just pick up on a point that Lisa had mentioned, which is this is likely a microcosm of all kinds of places across LA County, in California, and throughout the country. I had the experience of working as a social worker for an organization, a nonprofit in New York City, and the transportation system needs were not there because they have a different system, but everything else, it's pretty much spot on. It's pretty much spot on. You know, the lack of financial resources to leave, the shortage of emergency housing, these things carry from community to community. And so I think, you know, the work that we do here, it's about getting the word out beyond here also. I know people are part of national networks, statewide networks, LA County networks, and that's where we need to keep talking to each other and invite new people in, which is a big piece of what is happening here in the Antelope Valley through the Avenue program. So I just want to give them a shout out again. Okay, so let's talk about the recommendations. So in terms of the recommendations that we provided in the report that came out of our analysis of the data, what stands out to you in terms of like low-hanging fruit, things that could be actionable now, that may not need a lot of resources? What are your thoughts on that?
You know, as doing the newsletter, when I saw that one of our recommendations was creating an information sheet that provides guidance about services and like what parents can expect on their journey to accessing those services and being in those services, my initial thought was like, I can do that right now. Let's do it now. Like, this is something I can do. I was like, I'll work with anyone. I'll do it for free. Like, we can do that right now. That's no issue. If that's going to help someone, we can print out a few sheets, we can organize it, make it pretty, and we can do it. I feel like that's something that's easy.
I was going to say the same thing. So since I can't duplicate and just say ditto to what Mia said, although I want to, I do think so, and we'll collaborate on that, Mia. How about that? Okay. I also think that continuing to ensure, whether it's in a formalized pilot or any kind of a study, that the partnership of having Shanice teamed with the DCFS Lancaster office has been a tremendous benefit to our work together. And so I think as we move forward to continue to have people from different domains working collaboratively to talk about families, what their needs are, how we can ensure safety, what is the least intervention that has to take place to ensure that families are well and healthy and surviving is something that we should continue to work on. And I think that this collaboration, I would say, let's keep doing it. And I think that in other offices, if Brandon says okay, that this is, it does not take significant work. It's very actionable and it's very quick to be able to do. Connect with a local provider, make sure that there is some agreements, and then let's make sure that that collaboration is happening on a daily basis so that when there is the intersection can be discussed and talked about for best outcomes.
I agree what you're saying. The collaboration is awesome. I think a lot of agencies should do this. Some of the calls last about 30 minutes, some are longer, but just the resources between both of us has been great.
Shanice, can I ask you if you could share just a little bit about what a consultation looks like?
So when they give me a call, I ask them the demographics of the families. Was deviant narrative? If it was, we really go through the whole referral. We go through the family's history. Sometimes just requires just resources and like therapy for parents or for the kids or different things like that.
Okay, she makes it sound like very straightforward because that is how she's like so purposely driven. I love it. But there's like this knowledge base that you have that is different from what your colleagues at DCFS have, right? Yeah.
So on DCFS side, they're more child driven. On my side, it's more domestic violence driven. So to come together, the two, and like really sort out the stories is really good. I do make it sound kind of straightforward. It can get a little complicated, but usually it turns out pretty good. And all of the consults, I have them like call me afterwards to see a follow-up, like what's been taking place with the families.
Thank you for elaborating. Appreciate that. Okay, so then in terms of the recommendations, what of the recommendations did you read and go, oh, this is going to be so hard? And who might you feel needs to be in on that conversation?
This is hard. This is, the complexity is incredibly challenging, and it's layered. Domestic violence and the intersection with the child welfare system, it's so layered. Each and every situation is totally unique. And I think that's what makes it so challenging, is understanding, what am I reading? Because behind what we receive, which is a referral, is a family. And all we're getting is this handful of sentences that's trying to tell us something's going on. And then when we meet with families, we're trying to kind of peel back. It's layers and layers deep and years long, likely, and as you talked about, intergenerational trauma and years of perhaps their own child welfare history as children and domestic violence in the home when they were growing up. And so I think the continued and the huge challenge is having a deeper understanding of what are we looking at here? What is the risk? What are the safety factors? How do we help parent survivors and empower them to be the best that they can be when we're charged with a very heavy lift, and we're only seeing things for a very short time, and we have to act very, very quickly, but yet we have to hold a knowledge base that's it's not our specialty. It's an aspect of what we do and specialize in. But the true experts are people like Shanice and other parent survivors and our community partners that do this work. And so I think that's the biggest challenge, is just being able to know as we face each family, what are we really looking at and how can we best serve to ensure that we're doing what we are asked to do.
Thank you for that. I'm reminded also, as you were talking and as Shanice was talking, just that, part of the challenge, I think, in a more robust response and probably even more robust support for child welfare systems is the lack of funding for domestic violence service organizations. I think that we keep DV organizations like barely resourced. And that is really ineffective. Well, it's a very effective way to just keep people in survival mode. And it's not an effective way to kind of help people move through that into opportunity, into healing, into the ability to, more fully come back into their lives. And so the resources that I think are needed for these partnerships need to include some sort of consideration for better supporting domestic violence service organizations so that they have staff who could be of assistance instead of, just like working so hard and barely like meeting the need, I think that piece of it is an important piece to uplift.
I would also say space. Valley Oasis, you are a powerhouse, not only in the Antelope Valley, but everywhere. You guys see parents from other cities, other states, other countries even. And it's sad because you guys are, I don't want to say alone. You're not alone. You have lots of love and support from the community, but that space has to serve so many people. And we have this old notion of, well, why didn't you just leave? Why didn't you just take your kids and leave? And leave where? In the long wait line that we have here? You want them to wait? And where are they supposed to go? Sleep in their car where mothers have shared that they had to do? Sleep on the streets where mothers have shared that they had to do? They can't do that. That's unsafe. They'd rather stay home where they know their kids can at least sleep under a roof in a bed. They don't have time for these wait lines for services.
Piggyback what you said, that's the hardest thing. Our shelter isn't as big, so sometimes when we are full, parents do call and then they can't get in, so what do? They stay in a situation due to we don't have the capacity. If they're from this area, a lot of people don't want to go to a shelter down in LA because they have jobs here or their other families here, we just can't stay with them. So it's really hard when we are full and we don't have space for people.
Thank you. It makes me want to ask, just like for a quick show of hands, like whose work is touched by housing? Okay, so we have a lot of people with a lot of experience around housing. And in this case, we're talking about emergency housing, right? We have a lot of brain power right here in this space. So how do we collectively come together to start to support the space that Valley Oasis has, which is limited, to expand opportunities for emergency housing? Like that is what it's hard. I think about that as somebody actually outside said to me, oh, housing, we can't solve that. And I was like, no, but I think we can. As crazy as that sounds, I think we can if we work together and get creative. Okay, so let's talk about areas for future research. Based on the study and your involvement in it, what areas would you like to see pursued as the community moves forward?
This question always stumps me because as a research assistant, I'm going to say everything. And as someone from the Antelope Valley, I'm going to say everything because we need it. But I think something particular to this study, I think I would love to see, and I think the community would love to see the results, I believe, of our co-location that we began in the long run. I would love to see the effects, what you think is working, what isn't working, what's challenging, and what's easy. I would just love to see how that plays out, and also just to see how we could better it in the future, because everything can be better. But I would just love to see how that process went, so that others in Los Angeles County and across can see how you guys did it.
I just say just more continued research on just domestic violence. I think people still need to know about that. It needs to be continually talked about so it doesn't get forgotten and just pushed over to the side.
And I would say, similarly to what Mia said, but also I think when I started with DCFS 30 years ago, it was just spoken about as domestic violence. It wasn't nuanced, and you didn't know that, and you couldn't differentiate between what you would see. So any referral or any reference to any sort of conflict was labeled as domestic violence. And now we've learned so much more, and yet we still have so much to learn. And so having a deeper understanding of what that looks like, and then again, when that gets to the child welfare sector, really to understanding how we can learn more, and perhaps it will even come at some point with not only different classifications when we are looking at families and what the dynamics may be. And so is there a way to try to separate that out, for lack of a better word? I'm not a researcher, so I'm going to turn that to you.
Thank you for that. And I'm gonna we have some time, so I'm gonna take the opportunity to throw out a few more ideas. One of the things that, so we had an opportunity to present findings from this study at the International Child Abuse and Neglect Conference, which was in August. And so we talked about the findings, we shared it out, and then people were like, I have a question. And they said, what about the people who commit these acts of violence? Like, you didn't talk about them. And I said, you are absolutely right, we did not. And what we did learn through the data that we collected is that that group of folks kind of gets a little bit left out, not completely. They'll get referred to a batterer's intervention program or some sort of 52 once a week pay out of your pocket service, but there's a lack of real data on the efficacy, how effective are those programs. And I know for sure that there are programs that exist that use a trauma-informed lens that are being piloted elsewhere in the country. And these things really need to be tested out, because the fact of the matter is, until we have effective interventions for people who commit acts of domestic violence, we're gonna still be dealing with this at the rates it's going. And I know that I've had individual conversations with quite a number of people in this space that indicate that there is an interest in this area. It comes back to resources though. If you're gonna help raise money or get federal funding, helping parent survivors and their children obviously is key. But we also need to look at how do we stop the flow of the violence? So I think for me, that's a big area. Okay, and then our final question. Could you share a closing thought on your personal or professional experience related to the report? So anything that kind of just like touched you in a particular way as you read the report or throughout your experience in the project.
So I'm going to steal this for 1 second because you said that there was a little extra time. First of all, if every social worker and supervisor that's here in this room could just raise their hand. I just want to acknowledge all of you and the hard work that you do every day as you respond. to the doors of the children and families that are in the Antelope Valley. This is really, really tough work. And while the report did underscore, and we talked a lot, Brenda and Taylor, about the secondary trauma and what this does to social workers, it was not lost on me that while I don't do that direct work anymore, I know exactly what it feels like. You never forget. That's how Brandon and I met. I said a lot of years ago, I'll just leave it at that. And so what resonated for me is when I was a social worker and then when I became a supervisor, and it's very specific and ingrained in my memory, but I was really lucky that there was another supervisor in the office that really was a domestic violence subject matter expert and champion in the work. I know you know who she is. And I was able, when I had referrals and as a supervisor in cases when I was a worker, to go and be able to talk to her. And so to know when you think you have it figured out, you think you know what to do, your training and your education and your hands-on experience leads you to believe that you should do something in particular, and then you speak to someone who knows this with a depth that you don't, and you realize, oh my, what I was going to do or what I thought was going to help or what I thought was going to solve might be contributing to more damage. And I didn't mean that, but I need the wisdom behind me all the time. And so for me, the report just, I think in the totality and knowing where we started when we started this work and sat at tables trying to figure out what this pilot was going to look like, to where we are now and what we've learned together, and having Shanice be a part of the Lancaster team has really reinforced for me the need, as we've talked about, just for continued collaboration so that we're able to ensure that we inspire and empower, that we do not contribute to any more harm. And so I think that would be my biggest takeaway.
For me, my takeaway, the experience with the consultation with DCFS was huge. I think that if we never have done this, a lot of things wouldn't have worked out, you know. It's nice to be able to consult with somebody, even vice versa. Them consulting with me as DV cases and even child welfare cases, some things I didn't know. And doing my consults, got to learn on you guys' end as well. So I think the collaboration is huge and should continue.
Lisa, you brought up, I remember like sitting at that table the first day and going in completely scared because change is scary, and I'm like, what am I doing here? But I think sitting, like now, helping conduct this research, being able to interact with the amazing woman that we got to interview, and I wish Brittany was here because I feel like she should be the one talking. And then also, I would say being from the community, I think it was a real interesting experience. This work was hard. It was very hard, and I think I can say that for everyone. But it's powerful. I learned a lot, and I think reflecting on my experiences, the stories I've heard, the things that I think we've all experienced, it's never going to go away, and I'm taking that into my work every day, into the ED every day, because it's not going to stop, and I know that, and I have to mentally, I think, prepare myself for that. But I always say that something I always take away is like, yes, I'm a mandated reporter, but I tell myself that first, I want to be a mandated supporter. And I say that because I am a mandated supporter. I need to support my patients, my community, and the families. The families that you guys serve, they need all of us to uplift them and support them. not scrutinize them for their decisions. And just lastly, I really do hope that this report inspires and like truly influences change and just highlights the voices again of our parent survivors, because that's who we need to listen to.
We will end on that note. Thank you. Thank you, Lisa. Thank you, Shanice. Thank you, Mia.
All right, let's give our panel a round of applause. Thank you so much for sharing your insights, and a special acknowledgement of Brittany, who was in our video. She was also going to be here on our panel today, was not able to join us due to illness. But as you can see, the voices of our survivors are especially helpful, and we really appreciate their willingness to participate. Before we conclude today's event, we'd like to recognize another partner, Baby2Baby. Baby2Baby has played a unique role in our research by providing resources to the survivors who participated in our study. They've also, as mentioned by our Avenue team, been a critical support to families here in the Antelope Valley with diapers and other basic needs. We so appreciate Baby2Baby's willingness to embrace a unique role in conducting community-based research. Recognizing that this is DV Awareness Month, Baby2Baby has also provided diapers, wipes, and other survivors for survivors and their children. They're on the table in the back. We also have a number of books. Please visit the table if you'd like to collect items or pass them on to a client. Today has been an informative and rich discussion. We hope it generates new ideas in your work with survivors and their families. As you make your way out, we hope you will consider some actionable steps. Consider talking with a colleague about what you learned and how you might make one change in your work. We also invite you to continue the conversation with us. As this chapter of the work closes, we're honored to have the continued support from the Blue Shield Foundation of California to consider future strategies for scaling this work. We welcome your input and ideas for our next phase. Please share your feedback, enjoy refreshments, and we wish you safe travels home. Thank you so much for joining us.